Has anyone ever asked you why you haven't left Nigeria yet? I can't count the number of times patients have actually told me, even in the consulting room, that, okay, so why haven't you left?
Even this morning, I heard the question. It's becoming a routine now. At one point or another, during the initial days of my career, I weighed the option of leaving.
What is the most frustrating thing about working in Nigeria as a medical doctor now? Every week, we see headlines about doctors leaving Nigeria in their numbers. And many of us are familiar with the conversation around why they are leaving. Today, we want to ask a different question. Why have some doctors stayed? What makes a young doctor see the same challenges and the same frustrations, the same opportunities abroad, and still choose to build a future here? Are the doctors who stayed less ambitious? Perhaps less competent? Are they patriotic, or is it something else? Welcome to the Care Conversation podcast, a space for honest conversations about Nigerian healthcare, especially those conversations you don't hear often. I'm your host, Dr. Temitope Oyetunji, and joining me today is Dr. Ahmad Sani Bala, a resident doctor in family medicine and the CEO of Vital Aid Foundation. Dr. Bala, thank you so much for joining us.
Thank you very much, Dr. Tope. Thank you very much for having me.
All right. So before we talk about staying in Nigeria, let's talk about the person behind the decision. Who is Dr. Ahmad Sani Bala?
Dr. Tope, I think you did justice to the introduction, but still, let me just run through it briefly. My name is Dr. Ahmad Sani Bala. I'm a resident family physician practicing in Federal Medical Center, Abuja. I'm a public health advocate, and then also I am the founder of Vital Aid Medical Foundation. So it's a non-governmental organization. We chiefly we are responsible for providing healthcare services, especially with special interest in rural and hard-to-reach and underserved communities. So we've been doing that for a long while now with so much coverage, with the aim of having equal healthcare access to everyone, regardless of socioeconomic status, regardless of location, and then regardless of who the individual is. Just healthcare access, equity, and equality. So that's what has been keeping me busy over the last decade of my practice.
Okay, interesting. Yeah, because it's important for us to know that beyond the work, beyond the sacrifices that doctors make, there's usually someone behind all that work. They have goals, ambitions, visions, and at least you're giving us an insight into what it is you do. So let me ask you this question. Has anyone ever asked you why you haven't left Nigeria yet?
Well, Dr. Tobe, this is a question like even this morning I heard the question. Like it's becoming a routine now. So I take the question lightly and then I laugh. I don't blame people for seeing because they work with what is in vague. They work with their present day reality. Because most people now, by default, they think that any young doctor of my age group, my age range, should just finish, do the certification examinations, and then jackpot. That's the word for it. So some they ask genuinely out of concern. Some they ask genuinely out of curiosity, like, what are you still doing here? And then some out of disbelief that, yes, actually somebody within this age range is still around and then practicing in Nigeria. But I answered them with the easiest answer that comes to my as a response, like, yes, I'm still around in Nigeria. I'm very much around and I'm happy and enjoying what I'm doing here.
But have you ever seriously considered leaving?
Yes. Like many other doctors of my age range, it will not be realistic to say that I've never considered leaving because every professional weighs the option of better remuneration, better career growth, better working environment, and all that. So at one point or another, during the initial days of my career, I weighed the option of leaving. But then I realized later that at the center of it, what matters to me most is not just, yes, the remuneration is there and good working condition, but I just weighed the option of what I was doing, which I'm still doing, and then the impact I'm making at the center of it. Would I be as impactful as I would be if I'm somewhere else outside Nigeria and outside the communities that I mentioned I do most of my intervention? So that became more glaring, and then it informed my decision to stay back and then continue what we are doing.
Interesting. Now, this is a space for honest conversation. So let's
Yes.
be honest. There's nobody that's practiced in Nigeria healthcare system that doesn't know that there are frustrations you have to contend with. So, what is the most frustrating thing about working in Nigeria as a medical doctor now?
So there is this huge gap between what is possible and what is available. So seeing the frustration between ranging from manpower, infrastructure, remuneration, and all, you can see the frustration. There is what is obtainable, and then there is what is available. So seeing, and then that's from my own part as a physician. Then from the patient's part, now seeing somebody die of a preventable disease or developing complications of a disease that is actually preventable. Seeing a child getting complications from vaccine preventable diseases or any other disease that is preventable in terms of when the healthcare system is robust and working, these things are preventable and they shouldn't even be seen within the hospital, let alone getting complicated. So seeing these kind of things, even though you are trying as much as possible to work within the environment, the system, and then sometimes the system itself is not just enabling. Even though they are working on the system, we are recording progresses in terms of remuneration, in terms of infrastructure, and like where I work now, we are almost there in terms of making the system very, very favorable for us, the doctors that are staying back and giving our services. I would say that we are almost there. So it's quite encouraging. But still, there are one or two challenges that is systemic challenges, and it's across the healthcare system, not just specific to one place. So some of these challenges that could be better, you can see them, and then sometimes they can get into you and get under your skin and get you quite emotional sometimes.
I can totally relate with that. I actually wrote about that in my book. It's called Moral Injury. When you know, a doctor knows that there's something more they can do for a patient, for example, but maybe because of the system they work in, the environments they work in, they don't have that enabling environment to do that. So they feel morally they have not done the best for the patient because what is possible, they are not able to do it.
It's only what is available
Exactly
that you make do with that.
exactly.
Yeah.
So I can totally relate with that. Let me look at it this way. Now, I can't count the number of times patients have actually told me, even in the consulting room, that, okay, so why haven't you left? Or some people just thank me that, thank you for staying behind and seeing us and all that. So even patients tell you that. That tells you something interesting, that staying back has now become so unusual that it has to have an explanation. There has to be an explanation.
True.
And then there are some assumptions as well. One of those assumptions is that most of all the competent doctors have left, and those that are left behind are those who couldn't find anywhere to go. So when you hear that, how do you respond to that?
I've heard it over and over. Some I've read it on the net, I've read it on the social media and all, that the people that are staying behind could not pass the professional
credit
licensing
exams.
exams maybe all the exams to practice in Canada, to practice in the UK and all that. So you are unable to pass the exam. Some will genuinely ask you out of concern that, have you tried these exams? Have you tried these exams? Or is it the PLAB that's giving you an issue? They are even mentioning the licensing exams so fluently that you would think they are in the medical line. So I just tell them, like, casually, excellence and competence is independent of geography, right? Wherever you practice, so long as you have the necessary competence, you will make something out of it, and then you will make the impact. My watchword has been like giving in my best and then making the impact I should give, regardless of wherever I am. I could be practicing in the most advanced settings, but the impact is not felt by the people that are supposed to feel the impact. So I don't think it's dependent on geography. Wherever you are, ensure that you are well equipped with the skills that you need. We have excellent people practicing in Nigeria. We have what is now trending, like the reverse japa, where we see people from the supposedly Sena climes coming to Nigeria to have surgeries done by Nigerian trained doctors practicing in Nigeria. Because of the outrageous surgery fee there, the long waiting time for some surgeries like plastic surgery procedures and all that are not emergency, having them done there within a short period of time, it's not as accessible as having it done here because we have excellent hands here. So success and then excellence is not dependent on geography, as I said earlier on. Wherever you are, so long as you have you are well equipped with your skills and everything, people will come to you, because I know some of my consultants and my trainers that people come to them from across the country based on personal referrals, based on what they do that has gone to limelight and all that. People from across come to them. So whether you are in Nigeria or not, just practice according to standard, and then equip yourself with the necessary skills to enable your own practice.
All right, let's bring some balance into it now. Okay, so we've talked so much about staying. This is not a conversation about whether doctors, it is good for them to go or stay, right? But we're just highlighting the reasoning behind the decisions.
Yes.
Now, for example, I wrote a piece a while ago where I said that people who say that doctors are selfish for living, they are missing an important point. Just like you pointed out, it's not unique to medicine. Most people make career decisions based on what they can gain or
Remuneration,
avoid.
career growth,
Yes.
favorable working environment.
Yes, so it's not something that is unique to doctors. Now, I want to ask you this. Can someone be patriotic and still live?
Perfectly. Patriotism also is not dependent on geography. You can be a Nigerian living anywhere within
And
the
still
globe
be patriotic.
and still be patriotic. I've had mentors from across.
All right.
They are still my mentors, and they're practicing across different continents. They support my career growth in form of mentorship, in form of supporting my humanitarian activities, in form of opportunities for research and training, in form of meaningful collaborations, in form of creating opportunities for the younger ones also. So they are very, very patriotic compared to other people that are still behind in Nigeria. So patriotism it's not dependent on where you live or where you are presently stationed. No, it's in the mind. I have some of my colleagues also, many of my colleagues being mentored and also being influenced by people from across the globe that are Nigerians, but they are practicing for one reason or the other. They are practicing elsewhere, outside the shores of the country, and then they have been very helpful and impactful in their career growth.
Interesting. Most of these decisions that we make, it is based on what we see in our future. For example, somebody may not see a future practicing in Nigeria, and that may be the reason why they leave. Are there things that you think doctors are missing, opportunities in Nigeria that they may not be seeing, that are there?
Yes, we have vast opportunities, but it stems down to the medical school. I think we are programmed in such a way that right from medical school is only one career path. You finish, you write your primaries, you do a residency, and then you become a clinical physician or surgeon or anything. But we have diverse opportunities, which I don't blame, because we are trained by clinicians. And then the basic thing is for you to be a doctor and to be a good clinician first before every other thing comes secondary. So, but there are other career paths, which I'm happy some people are doing very much in terms of creating awareness of the diverse opportunity you can harness as a doctor, whether within the clinical practice, whether outside the clinical practice, other parts of medicine. In Nigeria, there are people doing very much in terms of medical entrepreneurship, in terms of policy making, in terms of creating job opportunities for the younger generation, and then in terms of training the younger generation. These are people that have identified, because challenges now, they said necessity is the mother of invention, right? So because of the challenges that are there, so it creates more clarity about how to get over or how to go over the challenges and how to create opportunities and then career out of the challenges. So people are really making very, very informed decision and then getting very, very good opportunities where other people see as challenges. So it's just the frame of mind that matters. But some people see opportunities where challenges are, while other people see the challenges and then it discourages them and they look out for other solutions. But as I say, I respect every individual's decision, the one that seeks to look for solutions elsewhere, and then the ones that choose to stay back and try to create opportunities and solutions where they feel more comfortable.
That is a very interesting point. So the same challenges that make some people want to go away is the same challenges that some other people kind of exploit, in quote, and make something out of that. Interesting. That's very interesting. I remember being asked during a job interview.
Okay.
The interviewer asked me if I had plans to relocate. Of course, they wanted to be sure that they won't give me a job and then the next month I'm on the plane to Calabar.
You gather money for Flap 2 and then you disappear from there.
Yeah. So I was asked if I had plans to relocate, and my answer was an emphatic no. So I was asked why. And I said, I've just always seen myself as a Nigerian doctor practicing in Nigeria. I want my people to be my patients because most of the meaning that I derive from the work is from the connections I have with my patients because of our shared experience, shared culture, shared realities. And if you took that out of my practice, I don't know what would remain. And that's a major thing for me. I feel like the impact I can have can be best had here and not outside the country. But that's me. For you, do you feel there are some, or there's a level of impact that a doctor can only make here and not outside Nigeria?
So coming from my own personal point of view, I think the impact I'm making and I still hope to make in the future will be best felt when I'm in Nigeria here. Because there is what distance does. Even if you can afford to fund some interventions, being present there and then seeing how one or two things you do transforms the life of people. Yes, it's not just about the monetary aspect or the reward or the recognition or anything. No, it's about just doing one or two tiny bits, but the impact and then the rippling effect, you can see it changing the lives of your people. Like you can see it changing the lives of people around you. You can see it going to places. So those kind of things, they are rewards that they don't even come in monetary way. They don't even come in anything material. So there's this component of job satisfaction I get whenever I go for a medical outreach in a rural community where people don't even have access to seeing a doctor. The nearest hospital will be kilometers away and all that. And then you just go there with as little as, do you want me their children of maybe helminthiasis, or you just do some interventions on neglected tropical diseases, which is what I do most routinely to all these underserved communities. So you do that and then you treat them on basic disease like malaria, just basic medications, diarrheal diseases and all that. And then you come the following day, you see a child that is almost dying of dehydration and all that. After one or two interventions, you can see the happiness and joy from the parents. You can see the sincere prayer from parents and loved ones and all that. So those kind of things, they move me deeply. And then when you weigh and compare the option of being somewhere else and doing it, you might be sponsoring this stuff from remotely, but the impact and then the drive and then the passion of the person coordinating it for you, does she share the same passion as I have? So these kind of things, they are still the impact, and then seeing the joy and the happiness in the people, somehow it's rewarding. It's quite motivating, and then it's among the things that still keep me going.
Let me ask you the answer is obvious, but it's still worth asking. So does Nigeria really reward doctors who have stayed in terms of salary, in terms of policy, working conditions? Do you think Nigeria has sufficiently rewarded doctors who have stayed behind?
So it could be better. And as I said now, so much effort are being put into those spheres, and we are recording remarkable progresses in terms of regulating the work hours, in terms of manpower, like replacement of people as they are leaving, they are replacing, and in terms of even recruitment of staff, we are doing. I'm using my center as an example. They are recruiting massively, and then they are replacing as people are leaving. We can't chain people. So if somebody leaves, there is replacement also. And then in terms of remuneration and then working environment, I think we are getting there. And I hope that when we maintain this tempo that we'll reach there eventually, so that Nigeria would also be a place where people from
want to
elsewhere
come
would
to-
live and come here.
Yeah.
We'll reach there in
In the near future.
Near future.
Let's hope in the near
Yes.
future. In my book, The Smart Doctor, I wrote about how the system we practice in influence our practice. Now, doctors can individually choose to rise above the system and still, do what's right, no matter what the system around them is like. But individual determination can only do as much. There's a point that the system also has to rise to, the level of making it easier for people to do the right thing, making it easier for people to want to stay and build here. You've mentioned some of them, but what are some of the things that you think can be done to make staying in Nigeria the obvious choice?
So the demand of the Nigerian doctor, it's not so far-fetched. Like, it's just the basics.
Okay.
In terms of let me start, because when we start talking about this issue, people are just sensitive when we start saying it's just their salary. They are talking about money.
Yeah.
It's not just the driving force. We want a better working environment where we can serve our people, and then where we can give our healthcare services, where we can give our expertise and healthcare services selflessly, with an environment and working environment and infrastructure that will support to give the best, to bring in the best out of you as a doctor, which translates to better healthcare delivery. So if we can have working equipment, if we can have conducive working environment, half of our problems are solved. The other half is remuneration. Yes, doctors are here. The economy is biting hard. We have huge families to support. We have extended families to support and all that. What the doctor is asking is just to get the basics. Doctors they just want to be comfortable, not outrageously rich. So basics now, their children should go to good schools that other civil servants are going, who don't even put in half of the effort the doctor is giving, or half of the sacrifice the doctor is giving. You should be able to transport yourself. You should be able to have a job security. You should be able to have a health security in such a way that when a health emergency that is life-threatening or is life-changing emergency happens to you or your loved ones, you wouldn't be running from pillar to post, getting donations from people for treatment and all that. So a doctor should have some level of security in terms of finances that will put his mind at rest. That would bring out the best in the doctor, because you can't have a doctor working and thinking about his child's school fees, thinking
Right.
about books, about buying books for the child, thinking about the empty tank of the car, waiting for him to, whether or not it would even drive him home or bring him back to the hospital the next day. Because you can't go into the first station and show your word code and then get free services and all that. So what is obtainable to doctors elsewhere, it's obtainable to doctors in Nigeria. And it's among the things that help the doctors and bring out the best in the doctors in terms of service delivery and all.
Okay. One parent came into my consulting room and then they said they wanted their daughter to study medicine, but the daughter did not want to study medicine. And then he said he doesn't know why not many people want to study medicine these days. And I totally understand his concern. Young people nowadays have many options, right?
True.
So, and not many people want to go into medicine anymore. But for those who are already in medical school watching, for example, what would you want them to understand about what staying in Nigeria can mean for a medical career?
Okay, I would love them to have an objective and broad mind and
Okay.
open mind, right? Because back then in medical school, as I said earlier, the thought process is just
Yeah.
one: finish, write your primary, specialize. They should have as broad mind as possible, and they should not rush into taking any decision.
Okay.
At least the year of the housemanship should give them an ample idea and the basics about going. And then their NYSC year also should give them an idea. They should study the system very, very well. And then they should know what they would want to spend the rest of their lives doing. If you want clinical medicine, you should know the challenges, and then the successes that come with clinical practices, and then the sacrifice it entails, whether practicing in Nigeria or outside Nigeria. The thing remains the same. For you to be a successful doctor, whether in Nigeria, whether in Canada, whether in the United Kingdom or in the United States, you have to have your basic skills. You have to have that hard work and dedication, because if you fail in Nigeria, it's even better. You even have the chances that being your own country of origin and all that, rather than going out there to go and make some mistakes that nobody would even overlook, the tiniest mistake, and then medical legal litigations and all. So whatever it is now, as a medical student, it's not just about finishing and leaving. Try as much as possible to learn the basics, because you build on them, nothing will come on a platter of gold. And then be as broad-minded as possible, so that you take an informed career decision that you live for the rest of your life.
I think that point about being broad-minded is a very important one. And I think there are so many examples that young people, medical students, can actually look towards. People doing different things apart from clinical medicine.
True.
There's health tech. There are content creators who educate, based on their knowledge. There's a lot. People are going into AI.
So much to explore. Telemedicine
Exactly,
is there. You can see-
exactly. How we can use AI tools to improve patient care and all that. So we still have a lot of options. We just have to be broad-minded. I think that is a very important point to note. As we wrap up, I want you to speak to the Nigerian doctor listening to us. So what would you tell the doctor practicing in Nigeria today?
So I'll tell us, myself inclusive,
Yes.
we are not there yet in terms of systemic things that we can't change, but we can see that one way or the other, the government is working in some aspect, and we hope to be there in the near future. So we shouldn't despair. We should continue. What is keeping us behind, what is keeping us in Nigeria, and what is making us stay back to practice should be our driving force. Rewards can come in different forms in terms of remuneration, which is we are hoping for in the near future, but they can come in different forms. And whichever way we are doing, let's just keep giving in our best. Whether the system acknowledges it or not, whether the people we are staying back for acknowledges it or not, posterity will judge you right. And then your conscience also is very, very clear. And then you have this deep satisfaction that you are giving in your best where it's needed. And then you are seeing the impact of what you are giving. You can see the impact. And for me, it's the major driving force.
All right. So finally, if you would want Nigerians to know something about doctors who have chosen to stay behind, what would that be?
Okay. We have had many opportunities to leave, but we just decide to stay back. As I said, and I'm reiterating, the people that leave, they have their justifiable reasons.
Yeah.
And it's respected, well respected. So those of us that choose to stay behind and practice in Nigeria, our reasons are equally justifiable, and it should be respected. Not that we don't have money for PLAB, our family did not raise money for visa and all that. No,
Yeah.
no. We've had opportunities, and we are still having opportunities that are still presenting themselves, but we have our reasons, also strong reasons of staying back, which we hope will keeping us back here.
Yeah, because it's a decision you have to make every
Every
day.
day,
Because
true.
every day you meet new sets of challenges
that would make you
that test that decision. Like,
true.
what am I doing? I hope I'm doing the right thing. There is no right thinking doctor, right? Who will not, from time to time, just think again.
Assess that decision.
Yes,
like,
I hope
am I
I'm
on
doing the
track?
right thing. I hope go back to the reason and then examine it
I
again.
do that a lot. So once I have that rethink and all that, I run to my mentors that are still in Nigeria and all
Yeah.
that. So conversations and all that, that's why I respect my medical elders, and then I respect the medical profession. We have this structure, and then we have this hierarchy and all. So anything that is not too clear to you or you lack clarity, you run to them. So I have my mentors that I surround myself that choose and believe in Nigeria. So I run to them once I get any form of challenge and all that. Sometimes by verbally interacting with them, sometimes by just watching them do one or two things. And then I get my answer, and then I go back on track.
All right. Thank you so much. So, like we said, the goal of the conversation was never about debating whether doctors should stay or whether they should leave. We just set out to explore the reasons why some doctors have chosen to stay behind. And we've been able to explore some of those. And to our listeners, whether you are a patient, a doctor, medical student, or just a Nigerian interested in healthcare conversations, we hope we have been able to give you something to think about. So thank you for listening in on this episode of the Care Conversation podcast. Let's keep the conversation going on our social media handles. And if you're a doctor practicing in Nigeria, I wrote a book specifically for you, The Smart Doctor. I'll leave a link in the description below. It's a good read. I know I have to say that, right? So why don't you read it and tell me otherwise?
It's a good read.
All right.
I can testify
All
to
right.
that.
You see, that's a testimony. Okay, so you can pick it up. I'll leave a link in the description. Till next time, remember that better conversations lead to better care. See you in the next one.